presentation. Good morning, my name is Yang Han. I'm from Columbia University. I'm here to present our work using harmonic motion imaging for HIFU monitoring on post-surgical human breast tumor. So we all know that ultrasound-guided HIFU has its advantage of real-time and with lower cost compared with MRI guidance. So we have developed harmonic motion imaging for focus ultrasound, which is an all ultrasound-based technique that can be used for breast tumor ablation monitoring. And this technique, we use amplitude-modulated HIFU beam for both tissue displacement and also ablation monitoring during the treatment. And with this technique, can you play the video, please? Can you play the video, please? Thank you. Oh, it's playing now. With this technique, we are able to locate the focal spot of HIFU, and we can also see the lesion forming in real time during the ablation. As you can see, the blue area, which is the lesion forming in real time. And we can also assess the character of the lesion after treatment. So the overall goal of this study is to develop a technique that can help all three stages of treatment, which are treatment planning, treatment monitoring, and treatment assessment. So the setup consists of two confocally aligned transducer where there is an imaging probe in the center and there's an HIFU transducer around it. The two transducers are confocally aligned with each other. And so for treatment planning stage, so to mimic the in vivo situation, we obtain mastectomy specimen immediately after surgery. And under the B mode, we can see the breast tumor, which is a darker area. And if we zoom in, we can roughly outline the tumor area. And then we scan the rectangular space with our technique. And then we overlay the displacement on the B mode, and we can see in the tumor the displacement is much lower than outside the tumor, which means there's a big stiffness contrast, and we can map that on the B mode image. And for treatment monitoring, we have ablated normal breast tissue and also breast tumor invasive ductal carcinoma. Sorry, can you play the first one again? Sorry. The first two. So as you can see, the displacement in the, go back please, sorry. The displacement in the normal tissue under treatment is going higher first, then becoming much lower, which shows the normal breast tissue under treatment at the end becomes stiffer. And it's and the trend in the tumor is decreasing all the time, which shows the tumor is becoming stiffer under the HIFU. And we also did raster scan on small ex vivo specimens, and we can plot 2D displacement map and reconstruct it into 3D before and after treatment. Then we can see how the lesion look like in the 3D compared with before. From statistic analysis, and we see that the normal breast tissue has displacement much significant different from both tumor and fibroadenoma. And if we compare the specimen with itself before and after treatment, we can also see significant displacement decrease in both normal and tumor specimen. So we conclude that with this technique, we are able to differentiate normal from pathological tissue, and we can also monitor thermal ablation and also assess the treatment. So our future work will be focused on real-time monitoring and also in vivo study. So I'd like to thank our funding source and also my colleagues. Thank you for your attention.
Okay. Any questions from the audience? Yes, please, go ahead.
Okay. So you showed the stiffness changes both for the normal and the malignant tissues. And okay, for the normal tissue, the stiffness reached to some kind of plateau. But for the tumor tissues, they didn't show any, show the plateau. So how did you determine the coagulation?
So the two ablation cases I showed, one is normal breast tissue, the other is tumor. So is that what your question? Yeah.
So in the normal tissue,
yes,
the graph reached to some bottom. So we can easily find that is the kind of a point which the coagulation happened. But well, in the tumor tissues, it just decreased and didn't show the kind of bottom. During the insolation, the value just decreased. So I couldn't determine when the coagulation happened.
So your question is like when to stop the treatment in the tumor case. That's actually that's another study we're working on. So in this study, we keep the treatment time to 2 minutes just to be consistent. So, but we don't know. So we're also trying to modify the parameter and to treat longer or shorter and do more analysis on it and compare with pathology too.
Okay, thank you very much.